Esophagitis. Definition. Esophagitis describes inflammation of the esophagus, which is the tube that connects the throat to the stomach. There are several types of esophagitis depending on the cause. Esophagitis can be caused by infection, irritation of the esophagus, or inflammation of the lining of the esophagus. Esophagitis is any inflammation or irritation of the esophagus. Common causes include acid reflux, side effects of certain medications, and bacterial or viral infections. This disorder can cause a variety of symptoms that include trouble swallowing, sore throat, heartburn. Risk factors. Weakened immune system due to HIV or AIDS, diabetes, leukemia, or lymphoma. Hiatal hernia, when the stomach pushes through the opening in the diaphragm between the esophagus and stomach. Chemotherapy. Radiation therapy of the chest. Surgery in the chest area. Medications to prevent organ transplant rejection. Immunosuppressive medications used to treat autoimmune diseases. Aspirin and anti-inflammatory medications. Chronic vomiting. Obesity. Alcohol and cigarette use. A family history of allergies or esophagitis. Potential long-term health complications. Causes. Esophagitis can be caused by infection or irritation of the esophagus. Infections of the esophagus can be caused by bacteria, viruses, or fungi, including Candida, a yeast infection. This is more common in patients with weakened immune systems, such as those with diabetes, HIV/AIDS, patients undergoing chemotherapy, or people who are taking antibiotics or steroids. Herpes, a viral infection. It may develop in the esophagus when the body's immune system is weak. One of the main causes of esophageal irritation is reflux of stomach acid. There are several causes for reflux. GERD, gastroesophageal reflux disease, weakness or dysfunction of the muscle that keeps the stomach closed. Lower esophageal sphincter can allow stomach acid to leak into the esophagus, acid reflux, causing irritation of the inner lining. Also called GERD esophagitis, in severe cases it can become erosive esophagitis. This also may be referred to as ulcerative esophagitis. Vomiting. When vomiting is frequent or chronic, it can lead to acid damage to the esophagus. Excessive or forceful vomiting may cause small tears of the inner lining of the esophagus, a rare condition called Mollaire-Weiss syndrome, MWS, leading to further damage. Hiatal hernia. This abnormality occurs when a part of the stomach moves above the diaphragm, producing a small abnormal pouch, or hiatal hernia, which can lead to excess acid refluxing into the esophagus. Achalasia. This is a disorder where the lower end of the esophagus does not open normally, and as a result, food can get stuck in the esophagus or is regurgitated. People with achalasia have a higher than normal risk of esophageal cancer. Medical treatments for other problems can also cause esophageal irritation. Surgery, including certain types of bariatric, weight loss, surgery, can lead to increased risk of esophagitis. Medications such as aspirin and other anti-inflammatory drugs can irritate the lining of the esophagus, and cause increased acid production in the stomach that can lead to acid reflux. Drug-induced esophagitis occurs when large pills are taken with too little water or just before bedtime and they dissolve, get stuck in the esophagus, causing irritation. Radiation to the chest, thorax, for cancer treatment can cause burns leading to scarring and inflammation of the esophagus. Other causes of esophageal irritation. Swallowing of foreign material or toxic substances. Diets high in acidic foods or excessive caffeine. Smoking. Pathophysiology. Signs and symptoms. Bad breath, halitosis. A feeling of food getting stuck while swallowing. Difficult and/or painful swallowing. Pain in the middle of the chest, often radiating to the back, usually associated with swallowing or occurring soon after a meal. An unpleasant taste in mouth. Indigestion. Heartburn. Acid reflux. Sore throat. Hoarseness. Cough. Mouth sores. nausea, vomiting, abdominal pain or indigestion. The grades of esophagitis. Los Angeles Classification System grades reflux esophagitis. Grade A, 1 or more, mucosal break no longer than 5 mm that does not extend between the tops of two mucosal folds. Grade B, 1 or more, mucosal break more than 5 mm long that does not extend between the tops of two mucosal folds. Grade C, 1 or more, mucosal break that is continuous between the tops of two or more mucosal folds but which involve less than 75% of the circumference. Grade D, 1 or more, mucosal break which involves at least 75% of the esophageal circumference. Types of esophagitis. There are several types of esophagitis. Eosinophilic esophagitis. Eosinophilic esophagitis is caused by too many eosinophils in the esophagus. This happened when body overrespond to an allergen. In children, this can make eating difficult. According to the Boston Children's Hospital, 1 in 10,000 children has this form of esophagitis. Common triggers include milk, soy, eggs, wheat, peanuts, tree nuts, shellfish. Inhaled allergens, such as pollen, can also contribute to this form of esophagitis. Reflux esophagitis. Reflux esophagitis is usually due to a condition known as gastroesophageal reflux disease, GERD. GERD occurs when stomach contents like acids frequently back up into the esophagus. This causes chronic inflammation and irritation of the esophagus. Drug-induced esophagitis. Drug-induced esophagitis can occur when take certain medications without enough water. This causes medications to linger in the esophagus too long. These medications include pain relievers, antibiotics, potassium chloride, bisphosphonates, drugs that prevent bone loss. Infectious esophagitis. Infectious esophagitis is rare and can be due to bacteria, viruses, fungi, or parasites. People are at increased risk for this type of esophagitis if they have a weakened immune system due to disease or medications. This type is common in people with HIV or AIDS, cancer, and diabetes. Barrett's esophagus results from untreated inflammation of the esophagus that can cause changes in the type of cells that make up the inner lining, mucosa, of the esophagus. Barrett's esophagus increases the risk for esophageal cancer. Behçet's syndrome, also called Behçet's disease, is a form of vasculitis that can cause ulcers in the mouth, esophagus, and other parts of the body. Graft versus host disease is a complication that can occur after a transplant, usually bone marrow transplant, when the newly transplanted cells attack the recipient's body. Esophagitis may occur in this condition. Cancer esophagitis may be a symptom of cancer of the esophagus, or metastatic cancer, cancer that started in another part of the body and then spreads to the esophagus. Diagnostic tests. After asking the patient about their symptoms, their medical history, and carrying out a physical examination, the doctor may order some further diagnostic tests. Endoscopy. A long, thin tube with a small camera at the end is threaded down the patient's throat. By looking at the esophagus and possibly taking a small sample, the physician can determine what caused the inflammation. Tissue samples. A small amount of tissue may be removed to determine whether the inflammation is caused by an organism, allergy, cancer, or a precancerous change. Allergy. Some tests may be performed to find out whether the patient is sensitive to one or more allergens. This may involve a skin prick test, blood test, or elimination diet. Esophagogastroduodenoscopy, EGD. An endoscope is used to directly examine the esophagus, stomach and first part of the intestines. In addition, tissue samples can be obtained, biopsy, to assess the severity of the damage to the esophagus. Esophageal manometry. This test is used to measure the pressure inside the lower part of the esophagus. A thin, pressure-sensitive tube is passed through the mouth or nose and into the stomach, which is then pulled slowly back into the esophagus. Upper GI series or barium swallow is a test where X-rays are taken of the esophagus after drinking a barium solution. Barium coats the lining of the esophagus and appears white on an X-ray, and can show the location and extent of damage to the esophagus. Management of esophagitis. Treatments for esophagitis are intended to lessen symptoms, manage complications and treat underlying causes of the disorder. Treatment strategies vary primarily based on the cause of the disorder. Reflux esophagitis. Treatment for reflux esophagitis may include over-the-counter treatments. These include antacids, Maalox, Mylanta, others, medications that reduce acid production, called H2 receptor blockers, such as cimetidine, Tagamet HB, and medications that block acid production and heal the esophagus, called proton pump inhibitors, such as lansoprazole, Prevacid, and omeprazole, Prilosec. Prescription strength medications. These include H2 receptor blockers, such as famotidine, Pepcid. They also include proton pump inhibitors, such as esomeprazole, Nexium, lansoprazole, Prevacid, omeprazole, Prilosec, and pantoprazole, Protonix. You also may be prescribed prokinetics such as bethanchal and metoclopramide, Reglan, which help your stomach empty more quickly. Surgery. Fundoplication may be used to improve the condition of the esophagus if other interventions don't work. A portion of the stomach is wrapped around the valve separating the esophagus and stomach, lower esophageal sphincter. This strengthens the sphincter and prevents acid from backing up into the esophagus. A newer treatment involves minimally invasive surgery to place a ring of tiny magnetic titanium beads around the junction of the stomach and esophagus. In that position, the ring of beads strengthens the lower esophageal sphincter, preventing acid reflux. Eosinophilic esophagitis. Treatment for eosinophilic esophagitis is primarily avoiding the allergen and reducing the allergic reaction with medications. Medications may include proton pump inhibitors. The doctor will likely first prescribe a proton pump inhibitor, such as esomeprazole, Nexium, lansoprazole, Prevacid, omeprazole, Prilosec, or pantoprazole, Protonix. Steroids. Some studies have shown that swallowed steroids such as fluticasone, Flovent, and budesonide, Pulmicort, may act topically in the esophagus and help treat eosinophilic esophagitis. The same steroid medications that are inhaled to manage asthma are swallowed to treat eosinophilic esophagitis. The doctor will instruct client on how to swallow the steroid preparation so that it coats your esophagus. This delivery system of steroids is much less likely to cause serious side effects than taking oral steroid pills. Elimination and elemental diets. A response to a food allergen is likely the cause of eosinophilic esophagitis. Therefore, elimination of the culprit food may be an effective treatment strategy. Drug-induced esophagitis. Treatment for drug-induced esophagitis is primarily avoiding the problem drug when possible and reducing the risk with better pill-taking habits. Doctor may recommend taking an alternative drug that is less likely to cause drug-induced esophagitis. Taking a liquid version of a medication if possible. Drinking an entire glass of water with a pill unless contraindicated. Sitting or standing for at least 30 minutes after taking a pill. Infectious esophagitis. Doctor may prescribe a medication to treat a bacterial, viral, fungal or parasitic infection causing infectious esophagitis. Treating common complications. A gastroenterologist may perform a procedure to expand, dilate, the esophagus. This treatment is generally used only when the narrowing is very severe or food has become lodged in the esophagus. In esophageal dilation, your doctor uses one or more endoscopic devices, small narrow tubes inserted through the esophagus. Versions of these devices may be equipped with a tapered tip that starts with a rounded point that gradually widens, a balloon that can be expanded after it's inserted in the esophagus. Lifestyle changes. Stop smoking. Remain upright while eating and for about 2 to 3 hours afterwards. Take small bites and chew food slowly. Avoid eating within 3 hours of bedtime or laying down. Raise the head of the bed by 4 to 6 inches. Put blocks or a foam wedge under the head of the bed. Lose weight. Wear loose clothing. Avoid aspirin or non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, Advil, Motrin, or naproxen, Aleve. Complications. Left untreated, esophagitis can lead to changes in the structure of the esophagus. Possible complications include scarring or narrowing, stricture, of the esophagus, tearing of the esophagus lining tissue from retching, if food gets stuck, or during endoscopy, due to inflammation. Barrett's esophagus, characterized by changes to the cells lining the esophagus, increasing risk of esophageal cancer.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.